My mom was 93 years old and started to have some health issues. We had some visits to the emergency room at Quinte Health. She was seen by a variety of specialists and different doctors. When we would refer back to her physician, they knew nothing about her visitation at the ER. There was duplication of tests, there was duplication of CTs. I think when someone's 93 years old and very fragile and vulnerable, very sick, they don't need to go through that. With Lumeo, they're going to have access to that information. They'll be able to scan her patient band and be able to get that information from shift to shift.
We're a human system. Sometimes things don't get passed along the way that they should be or to the extent that they need to be. I think Lumeo is going to give us the ability to access information in a timely fashion. It will provide better patient outcomes.
When you're there as a caregiver, you don't always want to ask too many questions because you know the staff are really busy. You trust they know what they're doing, but really you're sitting there the rest of the time after they leave and thinking, well, why did they do that? What does that mean? Is mom getting better? And I think having Lumeo, having that patient portal where we can actually go in ourselves and get a better understanding of what's happening in our loved one's journey will help reduce a lot of the stress on the loved ones.
Patients can look into their own record. They can be better advocates for themselves.
The majority of the time that we face our patients, they're not having the best day. They're sick, they're injured, their loved one is, yet our primary focus can sometimes be, let's get the information from you.
Your documentation system should enable you to spend more time at the bedside.
If we can't be there 24/7, we're always worried. We're stressed, not knowing what's being done with our loved one. Lumeo will provide a lot of the answers that a lot of the caregivers worry about at night. It's really important to all of us as caregivers to know that there's going to be a system out there that's going to help us help them and help our loved ones get better.